I have to battle it all the time with a medical doctor. Probably, one of these once a month at least, I would say, about a blood test. So why is a blood test not the test to take?
Blood's not the target organ of toxicity. Unless you're ready to fall over to toxic, you don't get anemia. Target organs are your brain, liver, thyroid, adrenal glands. Blood doesn't sample those. Those look, if you have a cut-up person or a cut-up animal, their brain, thyroid, adrenal gland, and blood look real different from each other.
Mm-hmm.
The colors, because they have different chemicals in them, they have very different composition.
Right.
They're not just all mixed up together. They're not all just like meat. So because they have very different composition, and the body maintains them that way, they can have very different levels of mercury in them. And in fact, they generally do. Those are the target organs. You don't sample those. There's no particularly desirable way to sample those. It doesn't really matter how much mercury the blood or urine has in it if those don't have too much. If those have tons, blood won't necessarily have any. Those hold on to it tighter than the blood. Blood-brain barrier keeps the mercury from coming out.
So I made the comment that if you had an acute exposure, if you were working in a place that used mercury, so it would be up for at least some period of time. How long?
Correct.
Yeah. So what would
a few months? If you go get some massive exposure and the only significant amount of mercury in your body is from that exposure, your blood levels will be nice and elevated for a month or two.
What about if you just let's say you ate some fish?
Unless you eat a particularly bad fish that's a dramatically high mercury fish, you just won't see it in your blood. It's too dilute in your body.
Okay. All right.
The problem with fish mercury is it enters your brain so readily and gets demethylated there and then can never come out. So fish mercury, you'll see relatively high hair mercury. It partitions into hair, but you don't see elevated blood mercury unless it's very, very dramatically high.
Well, I think it brings me, to my next question is what about hair testing? Because we get a lot about that. I think you're kind of going there.
Yeah, what you get about hair testing is the MD world acting like they're a bunch of ballerinas and laymen saying, oh, duh, the hair mercury's not high, they can't have mercury. And the answer is, well, that's like saying if somebody's MCV, mean corpuscular volume, is low, that their red blood cells are skinny and they need to eat more to fatten them up. And if the MCV is high, they need to put the patient on a diet because their red blood cells are fat. They need to lose weight. But in fact, elevated MCV means B12 deficiency. Low MCV means iron deficiency or thalassemia, genetic condition.
All right, say that one more time for my doctors because they should be writing that down. Say it one more time because I know they missed it.
A very, very standard screening test is the blood count, the complete blood count or CBC.
Right.
One of the parameters is the mean corpuscular volume or the volume with red blood cells.
Mm-hmm.
Well, saying that high mercury means you have mercury poisoning in a hair test and low mercury means you don't have mercury poisoning is like saying high MCV means your red blood cells are fat, you need to go on a diet.
Mm-hmm.
Low MCV means your red blood cells are skinny, you need to eat more. When in fact high MCV means you have B12 or folic acid deficiency, and low MCV usually means iron deficiency.
Got it.
And these tests aren't interpreted naively. If they were, there would be no reason for licenses. There would be no reason for medical school. Any chimpanzee could do it for you. You got to understand what the tests mean in more than a naive sense. And with the hair test, the fundamental understanding is the way that mercury has a lot of its toxic effect on you is it impairs your body's ability to move minerals across cell membranes. Sometimes it moves too much, sometimes too little. So what you see in the hair test of most mercury toxic people is that their essential elements are not right, that their essential elements may be all low or scattered all over the place. And a lot of times it impairs the transport of itself and other toxics, so you don't see very many toxics in the hair test. The most common presentation of mercury poison person on a hair test is all of the bars go to the left in the essential elements section, everything's low, and you don't see very much in the toxic section because the people just aren't moving any of the minerals into their hair.
That was me, Andy.
And
I
that
really,
says, that says mercury.
hmm
And
Yeah, I mean, of course I had no mercury show up in my hair.
that's not uncommon.
Yeah.
The average hair mercury of a poisoned person is actually less than the average hair mercury of a person not poisoned.
Because typically their body doesn't want to get rid of it.
Yeah, the body can't move it appropriately into the hair.
Right. And didn't we see that with autistic children?
Yes, that's right. This is a very nice study by Holmes et al. Where they analyzed hair mercury and hair tests in autistic children. There's another study by Jim Adams at ASU found the same thing. The hair mercury levels in autistic children actually lower than in normals.
Right.
And all of those children had pretty much the same mercury exposure because that was back when the MD world was in denial about reality, and so they couldn't be bothered to actually do a mass balance out of how much mercury was in vaccines,
right,
compared to how much mercury was known to poison little babies in the Seychelles and Faroe study. They realized they necessarily had to be poisoning a lot of them.
Mm-hmm.
And so you have all these kids get exposed to essentially the same amount of mercury, but it's not enough to poison all of them. Some get sick, some don't. It's kind of right on the edge. It's like, if you drank a beer, almost everybody can take it. If you drink 50 beers, everybody's going to puke.
Right.
But if you drink a six-pack, some people are fine, some aren't.
Exactly.
So this is like a six-pack of mercury. And the children who were more genetically predisposed to be sensitive to it or who had other required factors making them sensitive, they became toxic and showed the low mercury due to their body being stuck and holding onto it because it couldn't move it.
Right.
The children that were not so genetically sensitive, they could move it around, they got rid of it, their hair tests were fine, they were clinically fine.
Mm-hmm.
And this is part of the most difficult issue in mercury toxicity in a clinical sense, is every once in a while you do run into somebody who has an identifiable big exposure that you would expect makes them toxic, and they in fact are. Probably a significant number of people have an identifiable big exposure, except you can never figure it out and they don't remember it or tell you about it.
Right, exactly.
And they got toxic because they got a lot, but nobody realizes it. But the more common situation is people who apparently don't have an exposure a lot different from anybody else, and they're just the people by luck of the genetic draw are more sensitive. And the hair test allows you to look for that instead of having to just look for some absolute mercury level where, there's this big gray area, like the drinking a six-pack of beer of are you going to get sick from it or not?
No, I mean, this is, probably the only area that perhaps you and I disagree on, chelation, you and I are, which we're getting to folks on the phone, but, is testing. I mean, you love the analyzing the hair tests, and you teach that, and you. Well,
no, this is a little different than what you'll perceive from my books and what I lecture about, because it's what people ask me to lecture about. Mm-hmm. Is what I in fact advocate is any clinician who's going to practice in this area needs to develop their clinical skills, which will take a dozen or 2 dozen toxic patients, because the gestalt of how the people act and are and what they complain of is very, very distinctive. And you'll learn to make the diagnosis clinically with great certainty after you've seen a couple of dozen.
No, absolutely.
It's only at first where you're not sure if your skills in reading words on a page in a book is nothing like seeing a real live human being.
No doubt.
You're going to not feel comfortable and confident and need to do a test, and your lack of confidence will translate itself into lack of patient compliance, and they'll need to see a test.
No doubt. You know who needs it. Yeah, you know who needs to see? Right, the patient needs to see the test, sometimes more than the doctor. That's why, honestly, that's the only reason why I like a challenge, some type of heavy metal challenge. But as well as I do, some of your most toxic patients show up nothing.
Yep, that's my experience. Of the challenge test, I don't find it clinically useful at all, because very, very toxic people will have very low scores.
Yeah,
they just can't get rid of any of it.
You can't get rid of it. Yeah, exactly.
However, it's very, very effective at scaring the wits out of the patients. I don't advocate not being completely open and honest with them, but I realize that I may be naive, not being a licensed practitioner.
Well, I think I read this in something you wrote. I agree. The problem with even that testing is the fact that, look, brain poisoning or mercury poisoning is brain poisoning. In a chelated test, you're not going after what's in the brain. You're only really looking at what's in.
Yeah. You don't literally pee your brains out.
Yeah. I mean, so really, with that said, that states the whole problem with testing. Period. Is we're trying to figure out what's up in the pituitary hypothalamus, and the only way to do that is biopsy.
Yeah, which you don't particularly want to have done to anybody on general principles. And actually, one of the more useful diagnostic things, sounds very odd, but this is true, is mercury both impairs your making antidiuretic hormone, and mercury compounds are diuretic themselves. So if you're talking about a challenge test or a urine test and you want a 24-hour collection and you hold out the standard 3-liter container, and they give you a funny look like that's not big enough, they have a mercury problem.
No doubt about it. Yeah, I mean, it's so true. I mean, even in my own story, I couldn't make it through a night ever. I mean, matter of fact, when I was very sick, I was waking up 2 or 3 times to urinate through the night. And I knew when I was getting better, because when that started to go away,
I tracked my urine production going up and down as I was more and less toxic. At one point, it was 8.5 liters a day, which is very, very inconvenient. Normal is 1.5 with a kind of upper normal limit of 2.5.
Yeah.
And that's part of the endocrine impairment.